A lot of you must have heard about this term, pre-pregnancy counseling. Now, what exactly does it mean? It just simply means that a couple that is planning a pregnancy or planning a conception should really consult a doctor before embarking on a pregnancy. So why is it important that they do this? I mean, pregnancies have been happening for millions of years, and surely you don't really need to see a doctor before you plan one. Well, there are a few reasons why a couple should take medical advice before they plan a pregnancy. So typically what happens if you were to go to your doctor and say, "Doctor, I want to plan a pregnancy." So he or she will take a history from both of you. And this history refers to any medical problems that you both may have, any medical problems of significance in the immediate family, any habits, lifestyle habits, alcohol, smoking, recreational drugs. They'll also do an examination, check your blood pressure, check your weight, make sure that your blood pressure, your weight are fairly ideal for a conception. You'd also probably be asked to do a few blood tests, and that would include both partners, just to make sure that certain things are well within normal limits before you can embark on a pregnancy. So typically in blood tests, what do we look for? We look to make sure that you're not anemic. We also look to make sure that your thyroid levels are under control. We look for conditions called thalassemia minor. These conditions are more common in certain parts of India. And if the mother is positive, we check the father as well, or vice versa. We also check to make sure that the sugars are normal, because a lot of Indians, young or old, are diabetics, and we're increasingly finding that a lot of women find out they're diabetic when they first come in for a pregnancy. And this is important because uncontrolled diabetes may cause problems for the baby and cause abnormalities or congenital abnormalities in the baby during the process of conception. The other thing that we advise you is also to look for antibodies for a condition called, or a disease called, rubella or German measles. Now typically we are all given the MMR or the measles, mumps, rubella vaccination when we are children, and most of us have antibodies to rubella or German measles by the time we grow up into adults ready to conceive. Some women don't have antibodies. So what is the consequence of not having antibodies to rubella? Women who do not have antibodies to rubella and conceive and then unfortunately contract German measles or rubella can have babies that are affected by the congenital rubella syndrome, which can cause mental retardation, blindness, microcephaly. So it's very important to check if a woman has antibodies to rubella, and if not, vaccinate her. Another important thing that we advise any couple, especially the lady who's planning a pregnancy, is to take the vitamin called folic acid. Now, folic acid is a vitamin that is available in the foods we eat, but not in adequate quantities to cover or safeguard a pregnancy. How does it help the growing fetus? It reduces the risk of the baby having problems with the brain and spine, what we call neural tube defects. So this vitamin is very, very important for you ladies to start at least 3 months before you plan a pregnancy. So when you come to us saying we want to plan a pregnancy, remember there is a lot of work going into making sure that both of you are healthy in order to take the pregnancy forward and to be parents. So if you're planning a pregnancy, go visit your doctor, please.